A man wakes in the middle of the night gasping for air. Paramedics rush to save him, but it's all in vain.
He's dead by the time he gets there.
And a series of seemingly unrelated clues reveal little about his fate.
He had a toe infection, diabetes, diarrhea.
Has Dr. G finally found a case she can't crack?
And I pretty much ruled out everything that it could be.
Then, a young man in his 20s winds up dead in a motel room after a wild night out with friends.
There's a question of possible drug use.
His parents are desperate for answers. But will the truth be more than they can handle?
I just didn't know what to think. I didn't understand it.
I'm one of those early bird specials. Yeah, I'm always here a little bit earlier because I like to get everything situated so I know when the doctors come down in the morning, it runs smoothly. I usually unlock the cooler and I wheel the bodies out. And then I go and start my day's work. Dr. G is a good person, and she's always been kind to me and very patient with me, especially when I first started out, and I really didn't know much about how to do this job.
That'll be a first.
You gotta laugh and joke around because at times it can get heavy. That's a big part of what gets you through your day here. You never know what's gonna come in, and you never know what you're gonna deal with for that day.
You know, I see people in the morgue for a million different reasons, of all shapes and sizes, including old people. But it's unusual that I'd have to autopsy an older gentleman. We're more apt not to do an autopsy on an elderly person because they're often expected to die. Well, you know, we just don't live forever. So it was odd when I came in the morning to see an older gentleman that looks like I'm gonna have to autopsy.
Dr. G opens the file on Jerry Richards and quickly discovers why the elderly man is here for an autopsy.
The doctor's refusing to sign a death certificate because he says he really is not sure why he died.
A third-generation steel mill worker, Jerry was a tough man with a soft spot for his wife Elaine and daughter Melissa. Upon retiring, he convinced them both to trade Pittsburgh for sunny Orlando. There, they'd found a more relaxing life together. That is, until last night. 4:30 a.m. Jerry wakes up with an unpleasant feeling. He's short of breath. His wheezing worries Elaine, and before long, she gets Melissa out of bed.
He's not doing well. They call the doctor, and the doctor says, get him to the emergency room. They leave him sitting on the bed. They leave to go get dressed.
Moments later, they return, but are shocked to discover that Jerry is no longer conscious.
He's collapsed on the bed, and his eyes kind of rolled back.
He's not breathing, and they can't find a pulse. Elaine runs for the phone,
She immediately calls 911.
while Melissa fights to bring him back.
The daughter attempts to start CPR. EMS arrives. He's dead by the time he gets there.
At 71 years old, Jerry was no young man. Still, his sudden death stuns both Elaine and Melissa. They're now hoping Dr. G's findings will give them some sense of closure. Based on Jerry's age and the circumstances, Dr. G strongly suspects he died for a tragic yet simple reason.
You know, elderly people who die suddenly and unexpectedly, and they're walking, talking one minute, and they collapse the next, sounds like a cardiac death.
Yet clearly, his doctor was unconvinced. And the more she reads about Jerry, the more she understands why.
He's got a pretty complicated history.
First and foremost, Jerry had diabetes.
When you have diabetes, you have a lot of problems that can develop. One of the problems is you're more prone to get atherosclerotic plaque.
Plaque buildup in the coronary vessels can lead to a heart attack. America's #1 cause of death. A heart attack would fit with the circumstances of Jerry's death. But Dr. G spies an important detail in his report that suggests another threat to his life.
He had a toe infection. The doctor had just treated him for that.
This infection could also be a complication of his diabetes.
Toe infection's a common problem. You have some nerve damage from the diabetes and you don't feel things as well, so you're more apt to injure tissue peripherally, and you're set up for infection.
From Jerry's toe, bacteria could have launched a deadly attack on the rest of the body.
Certainly we've seen it before where you get an infection, it's not fully treated, and then it gets into your bloodstream.
While medical records do indicate that Jerry took antibiotics for his toe infection, Dr. G wonders if it may have been too little, too late.
There's a chance it could be somewhere else that wasn't totally treated, but we'd have to see.
But then she discovers a third possibly fatal complication in Jerry's recent health history.
Wow. The antibiotic gave him diarrhea.
One serious complication of diarrhea is rapid dehydration, the loss of water and electrolytes in the body.
This can be especially disastrous to the elderly who are sometimes more frail and less able to cope with the changes.
Dehydration causes death usually by generalized weakness. You know, you're losing a lot of fluids, your sodium can build up, and then that really you can end up with cerebral edema and seizures.
Dr. G notes that Jerry was given a prescription to combat the diarrhea, but so far, he'd only taken a few doses, and it is possible that the medication had yet to take effect. And there's another danger from diarrhea.
I mean, it's possible that he had a megacolon or toxic megacolon.
A megacolon develops when severe diarrhea causes harmful bacteria to inflame the bowel, to a point where it expands unnaturally to more than 6 centimeters in diameter.
And then the dilated bowel kind of perforates, and then you get the leakage of everything that should be in your bowel, which is stool and bacteria, into the abdominal cavity, which isn't a good thing.
Bottom line, Jerry's complex history obscures the truth about his death, which makes Dr. G's mission crystal clear.
So I think it's worth doing the autopsy to kind of figure this out.
Dr. G begins by exploring the possibility of dehydration.
Externally with dehydration, we'll often see the eyes sunken in their sockets. You've all seen people who are dehydrated. They look kind of gaunt. Their skin turgor is kind of loose and tense. You've just lost a lot of fluid.
After a thorough exam, however, she finds none of the telltale signs.
He certainly didn't look dehydrated at all.
But to completely rule out dehydration, she'll have to search for signs internally. For now, she continues the external exam and quickly uncovers a puzzling clue.
He's got a few little excoriations, like little scabs. I think he probably was scratching himself. Hard to say what that was from.
And far more concerning, she detects a reddish, congested look to Jerry's face and chest.
We see that a lot actually in heart attacks.
Jerry was an aging diabetic, which put him at a higher risk for coronary problems. It's looking more and more as if a simple heart attack may have ultimately been the culprit here. The rest of the external exam yields nothing more. Aside from the congestion, his body seems in good shape, including his toe.
Well, I've certainly checked his feet because, I'm wondering, if this is what started the whole chain of reaction of what's going on, and his toe actually looks pretty good.
But the fact that the toe is healed on the outside does not necessarily mean that the bacteria has been eradicated.
That bacteria then could get into his blood and start multiplying, and then your body reacts to that by your heart beating fast, you breathe fast, your blood vessels dilate, and you can't maintain your blood pressure. and you go into shock and you die if not treated very aggressively, very quickly.
But could something as basic as a cut on the toe have led to this man's untimely death? Only the internal examination can say for sure. Dr. G's scalpel is so sharp, it can slice through human skin like a knife through butter.
The scalpel is probably the most dangerous thing we have to deal with. Cutting yourself is our biggest injury.
Now, she uses her scalpel to cut a Y incision across the chest of 71-year-old Jerry Richards. Dr. G's first task is to see whether or not the diarrhea brought on by his antibiotic medication triggered life-threatening symptoms of dehydration.
So I'm gonna cut that.
And it doesn't take long to determine that Jerry's internal organs are neither dull nor dry.
His tissues were glistening. In fact, there appears to be maybe a little extra edema fluid, which certainly doesn't go along with dehydration.
She then checks for a second possible cause of death: sepsis, or a rampant infection that may have spread from Jerry's toe into his bloodstream and organs.
A lot of times people who die of sepsis, you get a vague appearance at autopsy that they look really sick and they start to decompose a little faster on the inside than we normally see. Can I quantitate that? No. That's just like 20 years of experience. You just get this like sixth sense that they're just not right.
In this case, her expert eye and instincts tell her there's no raging infection here.
Certainly he didn't look septic when we look at his organs. Everything looked okay as far as just grossly in the abdomen.
Through the abdominal cavity, she can also check the condition of Jerry's bowels.
One thing I am very curious about was when I look in his abdomen to see if there's any toxic megacolon or any perforation of the abdomen. Now, we don't have any history of abdominal pain, but it could have come on very quickly.
Yet his intestines, too, are perfectly normal.
And he doesn't have any perforation. His bowel really doesn't look that inflamed.
At this point, Dr. G is fairly certain of how Jerry did not die.
It looks like his toe infection's completely cleared, and he doesn't have any signs of an infection anywhere else. And I really don't think the diarrhea killed him.
Of the possible killers she's flagged in Jerry's medical history, she's suddenly left with only one.
Looks so bad.
Fortunately, it's her prime suspect, the heart.
The way he died suggests a cardiac death.
And Dr. G knows that as a diabetic, Jerry's heart was at grave risk.
You can get, accelerated atherosclerosis, and you get plaque buildup in your coronary arteries.
If Jerry had developed atherosclerosis, it could have reduced the flow of blood to the point where it set off a deadly heart attack. Now, assisted by her morgue technician Ashley Shaughnessy, Dr. G removes Jerry's internal organs and goes straight for the heart.
He has some pretty severe coronary artery disease. His left anterior descending coronary artery, that's the coronary artery supplies the front of the heart, was about 90% narrowed by atherosclerotic plaque, which was calcified. That right coronary artery, which supplies the posterior part of the heart, was about 100% occluded.
Blockage this bad could have easily ended Jerry's life. But there's another piece of evidence within the network of blood vessels that may suggest otherwise.
You can have 100% occluded and it not be the cause of death. Well, how is that? On the other hand, a little. Your heart has a way to compensate for that slow buildup of atherosclerosis by forming collaterals, meaning another coronary artery will form new vessels to supply that part of the heart.
Jerry's body had done just that. Form collaterals to help the blood bypass the blockage and prevent a full-on heart attack.
It certainly puts your heart in a weakened condition by having that 100% occlusion. But with the collaterals, it gives it kind of a Band-Aid on it, that it can survive.
Still, without a clear cause of death, Dr. G cannot rule out the heart just yet.
Nothing acute looking. He certainly could have died of a cardiac arrhythmia, but I have to finish the rest of the autopsy. Okay, let's see.
With no suspects left, this means starting from scratch, checking every internal organ for signs of any acute illness. She begins with the lungs.
As I'm taking the lungs out, I'll certainly look for pulmonary embolus.
A pulmonary embolus is a large blood clot that forms in an outlying vessel and travels to the pulmonary artery, where it blocks the blood supply to the lungs and strikes the victim down. It's often seen in bedridden patients.
Maybe staying in bed, not moving as much because of the sickness. But as soon as I took the lungs out, he didn't have any major pulmonary emboli.
Next, she inspects the organs from Jerry's abdominal cavity.
It's hard to see because the ligaments were holding it in.
But here, too, she finds nothing acute.
His kidney shows some nephrosclerosis. They were granular, and that goes along with maybe even some diabetes also.
Then, she checks to see if there's something going on in the brain.
Yeah. I worry about maybe a stroke or a hemorrhagic bleed. Okay.
After careful examination, however, all of the remaining organs appear healthy.
Nothing in his brain that would suggest why he died.
It's clear now that the autopsy of Jerry Richards has hit a brick wall.
And I pretty much ruled out everything obvious that it could be.
But Dr. G isn't ready to throw in the towel just yet.
Well, at this point, I'm going to really have to think about everything I've found and reassess the whole autopsy.
She takes a moment to review all her notes so far alongside the original investigator's report. At least the unfortunate chain reaction in Jerry's health is very clear.
He's got diabetes, which then set him up for the toe infection, which then had to be treated with an antibiotic, which gives him diarrhea, which then has to be treated.
The first thing she notices is how briefly he had been on his new prescription to combat diarrhea, an antibiotic called metronidazole.
They give him this medication. They only took a few of them.
Then she also recalls something she saw in Jerry's chest during the external exam.
Thinking back, he's got these scratch marks on him.
The two details suddenly click, and Dr. G knows exactly what to do next.
I need to look at the neck.
Dr. G continues the internal exam on Jerry Richards, dissecting the skin covering his neck.
The neck is my last hope.
If she's wrong, she may never have a definitive answer for what suddenly killed this 71-year-old husband and father. After a few cuts, she reaches the larynx. And there, her suspicion is confirmed. Jerry's airway is almost completely blocked off, not from choking on food or a foreign object, but because the tissue itself is swollen with edema or fluid.
I couldn't even pass my little finger into the opening of his larynx.
This narrowed, the airway clearly gave paramedics trouble as they tried to help.
They had a hard time intubating, you could tell, because I can even see injury from the intubation, but they never were able to get the endotracheal tube into that pharynx.
Dr. G has no doubt as to what this means.
It's clearly looking like it was an allergic reaction.
An allergic response occurs when the body's immune system overreacts to an antigen or foreign substance. It can trigger a host of symptoms, from sneezing to coughing to itchy hives. At its most extreme, however, it can induce a sudden drop in blood pressure and a rush of fluids that constrict the airway.
Plus, you get contraction of the small muscles of the lungs surrounding the bronchi, so you have a harder time getting air even deeper in.
And if the victim isn't treated immediately, the lack of oxygen can trigger a deadly heart attack in the space of just a few minutes.
These anaphylactic reactions probably in the United States kill anywhere from, several hundred to 1,000 people a year. Most of the people, it's going to be drugs, usually the penicillin, or a bee sting, or something they ate, like usually shellfish or peanuts are very notorious.
Based on Jerry's history, Dr. G believes that in his case, the trigger was metronidazole, the antibiotic he took to combat diarrhea.
An allergic reaction to metronidazole is very rare. But really, there are case reports of people having anaphylactic reactions to that medication.
To be absolutely sure of Jerry's fate, Dr. G requests a toxicology screen, checking his blood specifically for elevated levels of tryptase and IgE, two indicators of an allergic reaction.
When I get my tox, it does confirm what I thought at autopsy, in that his tryptase was very high and his IgE was very high.
The shortness of breath, the mysterious scratch marks, the congested look on Jerry's face. It all fits with a cause of death that trumps heart disease.
He had anaphylaxis, and even with a good heart, you're going to die from that.
Now, after what seemed like a series of dead ends, Dr. G can finally give Jerry's wife and daughter the answers they've been waiting for. It's early Saturday morning. Jerry Richards wakes up with labored breathing. Alarmed, his wife and daughter convince him the best idea is to go to the hospital, and they leave him, just briefly, to get dressed. What neither of them could possibly realize is that a string of related health problems is about to end his life in a bizarre final twist.
It's an unfortunate chain of events, to put it mildly. So he gets the diabetes, which then sets him up for the toe infection. The toe infection is then properly treated with the antibiotics, and then the antibiotics appear to be giving him a diarrhea.
To treat the diarrhea, his doctor prescribes metronidazole, a different antibiotic that for most patients would have mild or no side effects. But for Jerry, it is a catastrophe.
Nobody did anything wrong. He didn't know he had an allergic reaction to that drug.
Jerry's immune system, weak as it is, goes into overdrive.
There was a little bit of a red flag because he probably starts itching from the hives.
Unaware of the warning, he continues taking the medication. Every dose reacting like a toxin to his body. By Saturday morning, he's in the full throes of anaphylaxis.
His blood pressure goes down, his tissues start to swell. It swells so much that he isn't able to get air in.
His face turns red in the struggle to breathe. His throat constricted, he can't even call out for help. By the time his wife and daughter return, he's out cold.
They immediately call 911.
But it's too late. Within minutes, he dies before EMS arrives. For Jerry's family, this is shocking news that will take them time to come to terms with. But for Dr. G, it's something she faces every day in the morgue.
You know, the simplest thing, like a little toe infection, it's scary. Life is scary. Even though sometimes everything goes right, you still can get bad consequences. And that's not that anything is bad or that people did things wrong. There can just sometimes, with bad luck, have bad consequences.
But will Dr. G's next autopsy be another case of bad luck or too much of a good time?
They were drinking heavily. There was a whole group of them out. They had a bag full of possible cocaine. Thank you, God, for the good food and that we're here together and healthy and that we have each other. Amen. And let's pray that Eric doesn't get hurt in football. What other sport has an ambulance on standby?
Horse racing.
That's for the horse or the jockey?
One of each.
Dinner with my family and occasionally having a glass of wine, you know, it's one of my favorite ways of ending the day. Do I get to toast? What are we toasting?
Yes.
But I also teach my children that alcohol abuse is one of the main ways that people come into my morgue.
Dr. G opens the file on 25-year-old Michael Torio. Michael was very close to his family, living at home and even working for his mother at a restaurant.
Michael was wonderful. He was happy, full of life.
Yeah, we used to have a lot of fun together. You know, going to movies, going to wrestling, this and that.
But there was something else Michael loved to do. Party with his friends all night. And it was no different on the night he died.
He called me and said, "Mom, I don't think I'll be home tonight." He says, "I'm kind of chilling," was his word. And he says, "Well," he said, "I promise I'll be to work on time." And as always, I'd say, "I love you, Mick," and he'd say, "Love you too."
But little did she know, that would be their last conversation ever. According to the investigators' report, that night, Michael and his friends first met up at a local bar.
They've got a $142 bar bill. There's 5 of them, and the drinks are only $2 a piece. I don't know where they're drinking, but that's pretty good, $2. So you can kind of do the math. They're drinking a lot.
Closing time rolls around, but they're just getting started. They soon head over to a motel where Michael gets a room.
They all continue the party at the hotel room.
Finally, at around 3 a.m., he calls it a night.
He goes to bed. Some of his buddies leave. I guess at least one of them stays back.
The next morning, the friend wakes up and notices Michael fast asleep in the bed next to him.
He's still sleeping in the same position when he should be up getting ready for work.
But it isn't long before the friend realizes that Michael's not sleeping.
He doesn't respond. His friend calls 911.
The paramedics soon arrive, but they're too late.
They pronounce him dead.
Meanwhile, across town, Michael's mother is furious that her son hasn't shown up for work.
I blew up his cell phone, calling him and calling him.
At 3 p.m., her phone finally rings, but it isn't her son.
It was actually one of his good friend's mother that I haven't spoken to in a while, and she said, "Marion, how are you?" And I said, "I'm fine, how are you?" And she says, "Oh my God, you haven't heard." And I said, "Heard what?"
Her answer is at first beyond belief.
And at that moment, when I turned to my office door, there stood a police officer. And that's how I found out about Mickey.
The sudden loss of their son leaves Michael's parents groping for answers.
Michael was everything. He was every breath I took. I just didn't know what to think. I just didn't understand. I didn't understand it.
Now it's up to Dr. G to determine what killed him. On first blush, she doubts it was natural. Like most young men, Michael has no medical record, except for one odd note. Grand mal seizures.
And that's when a patient suddenly gets very stiff, and then after a period of being very stiff, will start jerking and shaking. And you'll also see a frothing at the mouth.
Sometimes a grand mal seizure can signal a serious condition, such as extreme low blood sugar or kidney failure. In Michael's case, the cause of the seizures is a complete mystery. According to his family, he had experienced 4 seizures in the past year, all spontaneous and with no other symptoms.
He didn't think nothing of it. He'd have the seizure and he'd be fine. Afterwards, you know, his life went on just like normal.
Now this is the sad part. He doesn't go and get medication for the seizures because he doesn't have any insurance.
He did not go to the neurologist. I even said, Mick, make the appointment and I'll pay for it. And he said, no, I'm fine. Don't worry about it, Mom. He says, you know, when I get insurance, I'll go.
Michael never did find out what caused his seizures. But while seizures can be dangerous, Dr. G knows they rarely end in death. And when they do, it usually involves a risky activity.
Like swimming and having a seizure and drowning, or driving when they're having a seizure, or being on a ladder having a seizure and falling off.
On the contrary, Michael died indoors in a bed. Still, Dr. G can't rule out the possibility that Michael's seizures, or the underlying cause of them, could have ultimately led to his death. However, as she reads through the investigator's report, Dr. G is starting to suspect that by far the biggest threat to Michael's life was not his seizures, but alcohol.
Alcohol is a central nervous system depressant. If you drink enough of it, it will cause you to stop breathing and then eventually cause your heart to stop. I don't see it a lot in the morgue, but I tend to see it in younger people who guzzle alcohol.
But then, Dr. G discovers something even more disturbing about Michael's night out.
There's a question of possible drug use in this hotel room. They had a bag full of possible cocaine.
A powerful stimulant, cocaine alone can kill in a number of ways, often as a result of cardiac arrhythmias or skyrocketing blood pressure, rupturing blood vessels in the brain. Combined with alcohol, the risks are even greater.
It actually forms a chemical in your body called cocaethylene, and you're more apt to get cardiac arrhythmias possibly when you even mix the two.
Cardiac arrhythmia is abnormal electric activity in the heart. It can lead to cardiac arrest. More and more, Michael's party is sounding like a deadly setup. But for Dr. G, investigating drugs and alcohol as possible killers won't be easy. Their trail can be extremely elusive in autopsy.
Certainly, I don't expect to see much with the alcohol and the drugs. I may not see anything, but if you don't look, you're not going to find it either. The family just has a hard time. You know, it's like, well, he has no symptoms.
As Dr. G begins Michael's external exam, she immediately notes a health issue unrelated to drugs.
He's morbidly obese. He's over 300 pounds.
Even in such a young man, such obesity can cause problems, including heart disease and high blood pressure, conditions Dr. G will investigate in the internal exam. But first she opens Michael's mouth, looking for any evidence that suggests he experienced a grand mal seizure on the night he died.
A bite mark to the tongue or bite mark to the buccal mucosa, that's the inside of your cheek.
Victims of seizures often bite their tongues or cheeks while seizing. And Michael's mouth reveals definite damage.
Oh, poor guy. He's got old bite marks. I can see a lot of scarring on the inside of his mouth. I just don't see anything new.
Fresh injuries would suggest that Michael had a seizure the night of his death. But Dr. G also knows it's possible to seize without leaving bite marks, and that seizures often come and go without a trace.
Just because you don't have evidence of a bite mark does not mean he didn't have a seizure. We certainly see a lot of people have seizures that don't have bite marks. Finding a bite mark just helps us say, yes, he probably did have a seizure.
For now, Dr. G must set aside that history and focus on one of her two prime suspects, drug use. Looking at his skin won't tell if Michael smoked or inhaled cocaine at his party. But if he injected the drug, she may find its signature, a pale, circular puncture wound.
I look for needle tracks. I don't see any.
In fact, By the end of the external exam, she's seen nothing that supports either drug or alcohol abuse at all.
So basically, we have a very overweight young man with no evidence that he uses IV drugs and really not much else. So I'm a little bit worried. I have really no idea why he died at this point.
Still exploring a possible cocaine-related death, Dr. G begins Michael Torio's internal examination by opening not his chest, but his head.
I think I can get it. Maybe using cocaine, he might have an intracerebral bleed or a ruptured aneurysm from that.
As a first step, she extracts the brain. On first glance, it looks normal. But to be sure, she must dissect it.
Similar to just slicing bread, very thin slices, looking for any type of abnormalities.
After a careful inspection, it's clear Michael's brain has no trauma, no tumors, no bleeding from cocaine.
I don't see any abnormalities.
Still, Dr. G can't yet rule out drugs without running toxicology tests. She's also no closer to finding the cause of Michael's seizures or determining whether or not he even suffered from one the night he died. The lack of clues is frustrating, but as a mother of two, Dr. G can only imagine the agony of Michael's parents as they wait for answers.
Personally, I don't think there can be anything worse than losing a child, no matter how old they are.
He wanted to have a family. That was his biggest dream, was to be a father.
He's on my mind constantly. I don't mean to get like this. I still wait for him to come home. It's hard.
I'm going.
Here, let me do, you want me to do the initial and then?
Whatever you would like, I'm just gonna put it down the table so we're not sticking as much.
Dr. G makes the Y incision down to Michael's navel, exposing the abdominal cavity.
So he's got a lot of abdominal fat.
Her first stop, the stomach, where she hopes to uncover some trace of her other prime suspect, alcohol. If Michael overdosed on alcohol, Dr. G may actually be able to smell it in his gastric contents.
A good night of beer drinking, I'd smell it. Gives us an idea maybe what's going on. Not the most pleasant part of the job. And in fact, some people hate that part of the job. It does often have a smell of vomit and that we're all familiar with. To me, it's just part of the territory.
First, she extracts the organ, then ties off both ends and cuts it open. A good whiff, and she's got her answer.
It really doesn't smell that much like alcohol to me.
That's interesting.
On the other hand, Dr. G finds something else in his stomach that could counter the effect.
I do see some greasy liquid things and some French fries. It doesn't sound like the healthiest meal, but then again, he's 300 pounds. I'm not thinking he's eating fruits and granola bars all day.
The fries, at least, may have slowed the absorption of alcohol into Michael's bloodstream and prevented the binge drinking from taking his life. But without the toxicology report, Dr. G can't be sure of exactly how heavily Michael drank before he died. One thing she does know: if he had also snorted cocaine, any amount of alcohol could have mixed with it to make cocaethylene. And that can cause a fatal cardiac arrhythmia.
So it could be the combination of the drugs with the alcohol, and that's what I'm guessing.
Though an arrhythmia leaves no physical evidence, she must still check the condition of his heart.
So I take his chest plate off.
Underneath it are his lungs, And as she removes them for better access to the heart, she finds something intriguing.
His lungs are very heavy. A normal weight would be maybe 350, 400 grams. His are like over 700 grams, very congested with some edema fluid. His lungs are just full of fluid.
Often, wet lungs are associated with a drug overdose, but they can also be a result of heart failure. She must press on to find out. What she uncovers next is a startling revelation.
I open his pericardial sac, and I notice his heart is very enlarged.
To some extent, it's not unusual to find a big heart in an obese person.
As you get bigger, your organs get bigger. And part of that is because as you get bigger blood supply. You are having more miles of capillaries that have to be fed.
To pump that volume of blood, the heart must also grow. But even for an obese man, Michael's heart seems abnormally large. When Dr. G dissects the organ, she finds that the walls of the ventricles responsible for pumping blood out to Michael's body have become thick and stiff.
He's got a cardiomyopathy of some type, a heart muscle disease.
Cardiomyopathy, which has many causes from high blood pressure to genetics to alcoholism, lands hundreds of people in Dr. G's morgue each year.
There's something inherently wrong with his heart. It could be partially worsened by his obesity, but the muscle is abnormal.
And yet, how exactly Michael's heart disease relates to his sudden death is still unclear. In fact, they may have no relation at all.
Well, the end of the internal exam, I have the history of the seizures. That certainly could play a component. Again, I've got still the drugs and alcohol, and then I've got his heart. That heart was a setup for sudden cardiac death. Toxicology is going to be key for this case because I can't go anywhere yet until I find what's in his system.
And when she does find out, nothing is what it seems. Over 4 weeks after the autopsy of Michael Torio, Dr. G finally receives the 25-year-old's toxicology report. And the findings turn the case upside down.
When the toxicology comes back to me, I'm actually shocked. He has no cocaine in his system. He has no alcohol in his system.
It appears Michael's alcohol intake the night of his death was moderate enough that his body processed it completely before he died.
So he clearly had stopped the partying long enough for those things to metabolize out of his system.
There's no trace of cocaethylene either, which means neither alcohol, nor cocaine, nor their compound could have taken Michael's life. With drugs and alcohol out of the equation, Dr. G must reconsider another possible threat to his diseased heart: his seizures.
Some people die from seizures called sudden unexpected death of epilepsy.
While the exact mechanism is unknown, scientists believe death may occur when seizures disrupt the brain signals to the autonomic nervous system, the part of the nervous system that regulates the body's organs.
What happens during a seizure, there's a misfiring or desynchronization of the autonomic nervous system, which probably contributes to cardiac arrhythmias or irregular heartbeats during a seizure.
Most seizure victims never experience anything close to major organ failure. But a heart as diseased as Michael's could easily stop beating under such stress. And while there's no physical proof that Michael had a seizure the night he died, Dr. G suspects the odds were stacked against him.
He's been having these seizures for the past year, mostly at night. They're increasing in frequency. Is he on medication for these seizures? No.
Even his general health could have been a factor.
People who are obese can have obstructive sleep apnea, where they don't sleep well at night. And if you're not sleeping well at night, that's going to lower your seizure threshold.
So based on, everything we know about him, most likely it was an interplay between the two. He died consistent with sudden unexpected death of epilepsy in conjunction with his bad heart.
Hi, this is Dr. Jean Garavaglia, dictating case of some -6.
Two unrelated conditions converging. One fateful night. Dr. G can now tell Michael's grieving parents how and why his life ended so abruptly. It's Thursday night and the fun's just begun. Michael and his friends are hanging out at a local bar. But he has to work in the morning and assures his mom that he'll take it easy. The party moves to a hotel room, but Michael keeps his word. He's been drinking, but in moderation. And by 3 a.m., he's in bed.
He goes to sleep, he metabolizes off the alcohol that was in him.
It seems no different than any other night Michael has spent partying with his friends. But in his heart, a catastrophe has been brewing, possibly for years.
It's thickened and large. Now, this is something that we found at autopsy that clearly he didn't know anything about. I wouldn't expect him to know anything about it because he didn't go to the doctor and he wasn't having any symptoms yet from it.
At the same time, for an unknown reason, Michael's brain has become susceptible to seizures.
We have no idea what's causing them. They start on their own.
And this night, the two conditions collide.
At some point during the night, he has one of his nocturnal seizures.
An electrical storm erupts in Michael's brain, triggering a chain reaction in his body. His limbs flail, his jaws clench, and most dangerously, his autonomic nervous system malfunctions, losing control of his heartbeat.
Nobody knows the exact mechanisms. They do know that when people have seizures, their heart goes down really slow.
Michael's heart, already in trouble, now beats erratically, quivering, until finally it stops. By the next morning, there's nothing his friend or anyone can do.
And they pronounce him dead.
Michael's grieving parents are thankful to finally have some answers, but the revelation is still difficult to come to terms with.
Never knew he had a heart problem. Never. I'm like, what kind of a mother was I? I didn't even know my own son had an enlarged heart.
That's a very difficult thing to pick up, actually. Even a chest x-ray, you don't do chest x-rays on 25-year-old men that don't need it.
All right, bye-bye.
I don't think you're ever relieved to find out why your son dies, but I think it really helped her to know that it wasn't the drugs or alcohol. I don't know how it made her feel because he couldn't get the help for his seizures. To me, that's still very sad.
Michael's family will never be the same, but it's his memory that inspires them to keep going.
You just wake up. You wake up every day and do what you have to do. Mickey lives in my heart. When I need that hug or I need to see that smile, I just look in my heart and he's there.
But from surrender. After a long while, I picked up one letter at random, opened it. Inside, I had written, I left because I thought staying would kill me, but leaving didn't keep me alive. It only changed the way I died. I closed my eyes. Pain rose, slow, deliberate, but it did not overwhelm me, not like before. I reached for another letter. You always think memory is loyal, but memory only serves the version of you that feeds it. Another. You don't miss Cuba. You miss the person you were allowed to be there. I felt something loosen in my chest, a knot untangling. The truth that had taken me years to avoid was sitting inside every envelope. I had been writing to Cuba, yes, but more than that, I had been writing to the part of myself I abandoned the moment I left. Not the island, me. The confession began there. The next morning, I walked to the park near my apartment. The air was cool, rare for Miami, and the sky soft with early light. I chose a bench away from the joggers, away from the dog walkers, away from anyone who might look at me long enough to see the guilt on my face. For the first time in 15 years, I allowed myself to think about why I left Cuba. The real why, not the story I had polished in the letters. I didn't leave for freedom, or opportunity, or ambition. I left because I was afraid. Afraid of becoming my father, a man worn down by disappointments he never spoke aloud. Afraid of shrinking. Afraid of failing where everyone could see me fail. Miami offered anonymity, a chance to disappear in a sea of other stories, a place where failure could be quiet. Leaving wasn't escape. It was hiding. Admitting that felt like swallowing a stone. I sat on that bench for a long time, letting the air move through me, letting the truth take shape. I whispered it, not to the island, not to imaginary versions of myself, but to the sky. I wasn't brave. I was scared, and I don't want to run anymore. The words trembled, but they didn't break me. They steadied me. That night, I returned to the letters with a different intention, not to indulge, not to escape, but to understand. I read them one by one. Some made me wince, some made me cry, some made me whisper, "Who wrote this?" Even though the answer was obvious. What surprised me most was how many letters were kind, gentle, forgiving. Some pages read like conversations between two versions of myself, the one who left and the one who stayed behind in memory. I realized that the collapse didn't come from the letters. It came from refusing to see what they had been trying to tell me, that I had split myself in two, that I had been grieving a homeland that may have been broken, but it wasn't the only thing broken. I was broken too. And the letters were the only place I allowed myself to admit that. The final push, the moment confession turned into awakening, came unexpectedly. While organizing the letters into piles, I found a sheet of paper folded differently than the rest. A smaller fold, neater, deliberate. When I opened it, I recognized the handwriting immediately. My mother's. It wasn't a letter, not really. It was a note she had written years ago, one I must have slipped between the pages of a book during the move to Miami. Her handwriting, soft, looping, patient, read, "Mijo, where you go, remember this. Not everything you leave behind is lost. Some things follow you, quietly, waiting for you to return to them." I felt my throat tighten. My breath catch. My mother had never left the island, but she had never left me either. The letters weren't portals to nostalgia. They were bridges to the parts of myself I was too ashamed to carry. My mother's voice, even in ink, pulled me back to shore. I sat on the floor, holding that fragile paper, and the confession finally reached its full shape. I didn't need to return to Cuba. I needed to return to honesty, to memory without fantasy, to myself without disguise. So I did something simple, quiet, necessary. I took a blank page. Just one. I didn't light candles, didn't turn off the AC, didn't try to mimic the Havana heat. I sat in my ordinary Miami apartment on my ordinary chair with my ordinary pen, and I wrote a letter. The first honest one. It began, "I forgive you." Not Cuba, not the past, not the government, not the world. Me. I forgive you for leaving, for being afraid, for building a home out of letters because you didn't know how to build one out of your life. I forgive you for getting lost. The words flowed easily. No tremor, no panic, no fever. Only truth. When I reached the end, I didn't fold the page, didn't address it, didn't stamp it. I placed the letter flat on the table. A letter not meant to travel. A letter not meant to return. A letter meant to stay. Confession freed something in me, not dramatically, not suddenly, but gently, like the